give it another minute or so, James? What do you think?
Yeah, another minute or so, let people log in, and I think we're ready to go.
Okay. Sorry?
Yep.
All right. All right, cool. Good morning, everyone. It's so great to see you all. For those of you that I have not met, my name is Noel Martinez, and I'm the president and CEO of the Palm Beach North Chamber. And I'd like to welcome you to this month's Small Business Advisory Council's event on the business of healthcare. We've got a great panel for you today made up of top Palm Beach North healthcare executives who are going to give you an update on how COVID-19 has affected their industry. All three panelists are huge supporters of the Chamber. I can't thank you all enough for your support, specifically DSS for sponsoring today's event. Thank you, Chris.
You're welcome.
Today, I am tasked with introducing our moderator, James Garvin. James is the owner of Forming Brand, a graphic design and brand strategy company. He is a Chamber MVP. He is the chair of the Small Business Advisory Council, the group that put this event together. He's a member of the Chamber now for over 13 years, and he's done a ton for our organization. James, thank you for all you do. It's all yours.
Thank you, Noel. Really appreciate it. It's a pleasure to be here this morning, not only with our three distinguished panelists, our friends from the Chamber, but also our community. It's really a great opportunity to be of service to our friends and community of Palm Beach North and really kind of talk about what's going on today, not only in the status of healthcare, but also in the current pandemic situation. We have three great panelists this morning. I'm so happy to introduce them to you. We have Christopher Kunney from DSS Incorporated, who is also our sponsor this morning, and he'll be talking a little bit about their company and then speaking a little bit to the current situation. As well, we have Teresa Urquhart, the CEO of Palm Beach Gardens Medical Center, and then we have Amit, Rastogi, the CEO of Jupiter Medical Center. I just want to welcome them this morning and say thank you for your participation and your time. We're going to have each speaker is going to talk for a couple of minutes about one of their organizations. Then we're going to go for some predetermined questions. At that point, we will open the chat to questions as well. If you have a question at any point during today's talk, please just go ahead and put it in chat. If you're watching on Facebook Live, we appreciate you tuning in, but also please go ahead and put your comments in the chat as well. They will be monitored and forwarded to us to discuss today. I ask that everybody on the call, on the Zoom today, please mute your speaker, your microphone unless you're speaking. It's in the lower left-hand corner of your screen with the little microphone icon. So if you take a moment, I'd really appreciate it so we can make sure we hear our speakers uninterrupted. With that said, Christopher, I'm happy to give you the floor, sir.
Sounds good. Well, my name is Christopher Kunney, and I serve as the Chief of Strategy and Business Development for the sponsor, DSS Incorporated. We're excited to support this program and looking forward to a very interesting and lively conversation. My role at DSS is focused on the commercial side of our business. We are very excited to launch a cloud-based inpatient electronic health record system called Juno EHR that we're bringing to the market this year. And I've been brought on board with my fellow colleagues to help lead that effort. DSS as a company has a almost 30-year rich history of delivering technology solutions and integration services for the healthcare space. We actually are very proud to be one of the key support vendors for the Veterans Administration, and we have implemented well over 15 plus or more applications in every VA hospital across the country. So we literally serve one of the largest healthcare systems in the country. Not only that, we support their I'm providing integration services for their electronic health record system called VX Vista. And we're working closely with Cerner to assist in the migration to the new platform over the next 10 years. I've been asked to come on board and talk a little bit about how technology is impacting the pandemic and offer my perspectives around that as well too. But before I start that, I just wanted to, first of all, recognize and offer my support and appreciation for all of our healthcare providers and first responders, and commend them for the efforts that they're making to support our communities during this pandemic. They're putting their own lives at risk and their families' lives at risk to continue to support us and provide care and meet the missions of their organization. So I just wanted to say on behalf of DSS, we appreciate your efforts, and if there's anything we can do to support you in that effort, don't hesitate to reach out to us. Now, that being said, you know, I see the COVID pandemic as kind of a perfect storm. And what I mean by that is, you know, healthcare systems have relied on, you know, kind of well-established disease management pathways and evidence-based care approaches for standardizing the delivery of care and improving quality and safety within their facilities. Now enter COVID-19, and that model to some degree is being turned on its head. Healthcare organizations now are under immense pressure to scale up capacity, you know, to keep infection rate under control and minimize the risk of exposure to their patients and to the workforce. The COVID-19 global pandemic has really created the need for new business models and new clinical capabilities, such as contact tracing, virtual care, you know, mass temperature scanning, touchless technologies, surveillance technologies, and many, many others in support of the mitigation of the pandemic. And it's also put an additional strain on these organizations' operations because many of the normal procedures that would be done in the acute care setting are being postponed or put on hold, and that's impacting the bottom line. So not only do these healthcare organizations have to continue to deal with the volumes and spikes that are occurring as a result of the pandemic, they're trying to find creative ways to continue to keep their doors open while continue to provide services to the community itself. Our company, DSS in particular, is working with its customers, its healthcare organizations, to support those efforts by really retrofitting a number of our technologies that are normally used within the clinical and business settings to help track, manage, provide information in support of the pandemic. For example, we have a product called ThoroDoc, which is a real-time clinical decision support for infectious disease surveillance and prevention for the clinical pharmacy workflow. And we've retrofitted that technology to capture information related to COVID-19 and provide, you know, analytics that help provide a better understanding of the impact that it's having on a specific community. We have other products that, you know, I don't have time to go into in great detail, but we are making that commitment to those organizations to find ways to take the existing investments that they've made, retrofit those, but also bring to bear new technologies and emerging technologies that are needed. These challenges that exist today within the clinical care setting are forcing clinical leaders to start thinking about how to deliver care in a different mode. And I'm sure my colleagues will talk more about their efforts around things like telemedicine, as well as surveillance monitoring and contact tracing in greater detail. But those are starting to become very emerging technologies and solutions that are being brought to the market and being adopted more within those settings. the challenge I think that has happened, and as a former CIO and IT strategist, I saw some of the challenges that existed in the adoption of these technologies in the marketplace today, primarily because of regulations, some around the technologies themselves, and just change management that would be needed to start to adopt and make these a part of the normal business practices and clinical practice. But COVID has really forced us to start thinking about things a little bit differently. I think the term is necessity breeds innovation. And I think that's what's happening today. And so these healthcare providers are now embracing these technologies and to some degree finding some real value by using these technologies. It's making them more efficient. It's allowing them to take those services that might have been delivered within the brick and mortar and pushing them out to virtual care settings. It's creating, quite honestly, an increased patient satisfaction because patients now don't have to drive into facilities to get some of this basic care. And it's freed up resources to focus their efforts on more critical activities, not only just related to the pandemic, but to other types of care that they're delivering in the acute care setting. As again, a former CIO, technology has become the enabler for the support of the pandemic. And many healthcare technology leaders are really focusing their efforts in a number of different ways. They're looking at ways to update the core IT investments like their EHRs to support the COVID-related clinical workflows. They're scaling up, again, their virtual care programs, and not only just virtual care, but virtual work programs. And so health organizations are looking for ways to have their employees who are non-essential in the care setting to work in virtual environments as well, too. Creating ways to provide better analytics and information that gains greater insights on the treatment of the disease. And then ensuring that in these virtual settings, privacy and security continues to be maintained throughout the process itself. Organizations around the world are, again, leveraging these types of technologies to support the pandemic. They're looking for emerging solutions to support that, and we'll probably talk about that in a little bit greater detail during the panel discussion, but I'll just at a very high level touch on a few things. Again, telemedicine and remote monitoring, artificial intelligence, disposable devices that can be used in a remote care setting, again, touchless technologies, collaboration tools that enable remote work, things like Microsoft Teams, for example, or even what we're on today, Zoom. The fact that we're able to have a conversation like this virtually says a lot about the direction that industries are going to continue to collaborate and provide value to its constituents. Contact tracing technologies, robotics and drone delivery technologies. And one of the big challenges many healthcare organizations have been experiencing is around supply chain, around drugs, PPEs, and other essential equipment. And how do we improve that just-in-time delivery of these solutions, these products and services, so that they can continue to provide quality care. Another emerging technology is things like 3D printing, for example. Because of the shortage of masks and PPEs and other products, many healthcare organizations are, adopting 3D printing technology to create things like, again, screens and other protective materials to support their clinical environment as well. So there are a number of emerging solutions that are starting to impact the industry in and of itself. And I'll stop there for now and allow the rest of my colleagues to weigh in on the conversation, but I'm excited to be a part of this dialogue, and I look forward to hearing what they have to say about their experiences as well.
Great, thank you, Chris. And next up is Dr. Amit Rastogi from Jupiter Medical Center.
Thanks, Jim. First of all, I want to start off by thanking Noel and the team, for putting together this forum, and for Chris and DSS for sponsoring this. The reality of it is that even though you can't turn to a newspaper or to any TV channel without hearing about the pandemic, I always feel that there's a bit of an information overload, and forums like this that provide folks like Teresa and myself who are really in the trenches to provide our perspective, hopefully provides value for the audience. So again, thank you very much for providing this venue for us. I think all of us will agree that this pandemic, especially in today's world where information is so freely available, this probably affected just about everybody across the globe, regardless of occupation, regardless of education, either directly or indirectly. But I have to say that I think any of us who are on the healthcare provider side are probably dealing with this much more so, because we literally are at ground zero, and certainly are the front lines as well. I have to say, as Jim mentioned earlier, I am a physician by training, and I'm so glad I did not miss the pandemic classes during medical school, because it gave me a great appreciation for how this thing can evolve into, which I do think helped provide some perspective as we started thinking about this in January at the medical center. We were actually fortunate to start preparing early, and thinking about PPE and testing supplies, and really started getting ahead of some of the supply chain issues that Chris mentioned earlier. It's a little bit ironic at this point, because initially the team was wondering why I was trying to order tens of thousands of many things when we might only see a couple hundred patients now. They're all glad that we did do that. Also even doing things like preparing staff early for understanding what the emotional impact of this is going to be, right? I think one of the things that we talk about, even though there's shortages in supplies, shortages in testing, there's emotional toll that a lot of this can take off care workers. And fortunately, we started addressing that early as well, with regards to rotating shifts and providing different avenues for stress relief for our nurses and a lot of our other frontline caregivers. I think one of the things that is not talked about enough is how much the pandemic is affecting even the non-COVID side of healthcare. I know we're all aware of some of the executive order, which had to stay on elective procedures. And even though that was a short-term impact from the standpoint of, there was a couple of months where we were not able to provide certain types of procedures, the impact of that, not just the state, but also of people who have non-COVID conditions staying away at this point from healthcare facilities and from their providers, I do think that that impact is going to have, quite frankly, a headwind that's going to be there for the next many, many years. We're already starting to see across the country where people are coming in with more advanced cancer or with more advanced heart disease or strokes when they could have come in with simple symptoms earlier, because again, they're afraid to go back in to see their providers because of other COVID patients, or to go close to hospitals. I know us and many of the other healthcare institutions are doing quite a bit to educate folks around that, because again, I think it's incredibly important for us to remember that, not just for us, but for our families and for the community, it's important to make sure that we still are addressing and are not afraid to seek help for any of the non-COVID healthcare needs that we may have. I do think that even on a systemic level, much of the safeguards that we've put in place with regards to infection control procedures as a result of COVID are here to stay. And I'll draw a parallel from that. So when I went to medical school back in the 90s, at that time we were really in the midst of the AIDS epidemic. At that time, it was not uncommon if you went into a phlebotomy lab or to a hospital room and you were having your blood drawn, some of the technicians would be wearing gloves and others would not. I think the AIDS epidemic changed that forever, and in a good way, because that brought about universal precautions for how blood products should be handled. And luckily that has stayed in the healthcare industry, ad infinitum. I do think that from an infection control standpoint, COVID is going to have a similar impact, and I think it'll be a long-lasting one. Because if we think about the technology that we have available, just about every healthcare facility, and quite frankly, even now, a lot of non-healthcare facilities have, temperature screenings, which are done en masse when people, enter into facilities. I think those things are here to stay, and probably are a good thing from a public health standpoint, even once, COVID has subsided. The other industry, which I think has been ready for prime time probably for about 10 years, and I know Chris alluded to this a bit during his segment, is around telehealth. All of us in healthcare know that the technology for telehealth has actually been sufficient and accessible for about 7 to 10 years. But because of either payer issues or because of regulatory roadblocks, it never really came to the forefront. I think we all realize now with what's happened with COVID, and as some of those roadblocks have been taken away, what an incredible tool telehealth really is for all of us. I can tell you that in some of our primary care practices, especially as folks during the initial wave here earlier in the spring, when folks were afraid to get into the doctor's offices, we saw some of our in-person visits drop by 90%, but our telehealth visits went up about 700 or 800%. And I'm glad to see that happen, because otherwise, if you think about the corollary to that, which is if those people had not come in for that health care at all, we'd be, again, as I alluded to earlier, be seeing a lot more sick people, dealing with different diagnoses. I do think that telehealth at this point is here to stay. I don't think it's going to be to the level where it is today, because the reality of it is that people still want to see the doctor, they want to see their provider face to face. But the advent of telehealth will definitely have much more traction going forward than I think has had in the past. Things like artificial intelligence for contact tracing. We're talking a lot about that for COVID today, but in the future, I see that even once, let's say, COVID has subsided, a year or 2 years go by, for influenza, which is a perennial event for us. I see contact tracing using artificial intelligence as a tool for that in the future as well. One of the things that we struggle with on the hospital side, that we struggled with for decades, is how do we continue to improve communications for patients and their families. Now, as we came to realize that as many of us had to stop visitation from an infection control standpoint, we gave patients iPads in their rooms to be able to communicate with families. That, again, opened up another avenue for us. And as we think about going forward, why should that stop, right? Because why shouldn't we always do more things to be able to improve communications, for patients and their loved ones when they're in the hospital. Just a couple of closing comments is that, one, I do think that for the next year or two, we are all going to live, regardless of what industry we're in this COVID and the non-COVID world. The best thing that all of us can do is play our own part with regards to infection control, and we all know what those are with regards to face masks and hand washing and staying at least 6 feet away, even if we're on Zoom calls. Don't get too close to the camera. I'm just joking about that piece. But I think that again, that the last piece I want to leave folks with is, please, for yourself and for your loved ones, it's just important for everybody to remember, and again, I'm a primary care physician by training, that don't forego your preventive healthcare needs or your non-COVID healthcare needs, because delaying those for a year or two will only have more deleterious effects on our own health as time goes on. Thanks very much, Jim.
Thank you, Dr. Rastogi. Next up, we're going to have Teresa Urquhart with the CEO of Palm Beach Gardens Medical Center. Teresa?
Hi, good morning, everyone. Thanks for zooming in to join us this morning. It is great, the technology that we're able to utilize nowadays with COVID, we've all had to look at, as Dr. Rastogi said. The healthcare industry, like all industries, have been impacted by COVID-19 in some fashion. And so what it has made us do is take a look at how we do our business and to look at opportunities that we can streamline, be more efficient in terms of what we do. In the healthcare sector, we are currently seeing the same types of trends that are being seen throughout the state of Florida in terms of a younger population of patients that are being admitted to the hospital. And we're seeing some lower mortality rates as it relates to that. In addition, some of the things that we continue to see that Dr. Rastogi also mentioned is that the people in the community are avoiding or not seeking care for true signs and symptoms of heart disease, strokes, or other types of things. So, I think one of the things that's sometimes difficult for community to understand is that here in the healthcare world, we are caring for a lot more than just the COVID population. We have our non-COVID patients as well. And when people are delaying their care, either seeking care from their physicians or if they need to come to the emergency room, when they finally do have to come, the acuity of our patient mix is much higher than what we've traditionally seen in the past. And so it's just very important that the community feel comfortable about it going to hospitals, because we are safe facilities to come to seek care and to get help that you might need. We have been here doing a lot of different comprehensive safety measures since the pandemic started. Actually, before that, we were planning. And so, we are still doing temperature checks for anybody that comes into the facilities. We're doing universal masking throughout, includes patients, visitors, our employees, physicians, and everyone that comes in the facilities. And I think that's critical. One of the things that you'll hear me talk a lot about is that the prevention of COVID is really protection. And so I think the hospitals have done a phenomenal job in making our staff feel safe and being safe with the different practices that we have in place throughout the facilities. And also for people that have come to the facilities, they can see that we have mechanisms in place to keep them safe as well. We have social distancing placards throughout the facilities, in all of our different waiting rooms, sneeze guards, and lots of different other measures to keep everybody safe and aware of the prevention that is necessary to help reduce the spread of the COVID virus. As it relates to the changes that we've made in healthcare, a lot of it has been in the virtual world, like we have virtual meetings and lectures and the meetings like we're having today. And probably one of the hardest things, I think, as a hospital CEO has been the lack of visitation allowed during certain times for the patients and their family members. It's very difficult when you have a loved one in the hospital that you want to be able to reach out and see and touch and hug and all those kind of things. And we're not allowed to do that, obviously for infection control purposes and for safety of everyone involved. So we have, much like Rastogi mentioned, the iPads that we have available to our patients. And then we also have our nursing staff who are coordinating calls with families at a time that's convenient for families so that we can connect with them and answer questions that they may have about their patient that may be here in the hospital. And I agree that this is something that I think will continue to stay once we get through this COVID situation. I think, again, for a long time, we're going to be living two tracks. And hospitals have done a really good job of separating and having two tracks. The COVID track, which, we have our COVID patients that are in separate designated areas than the other non-COVID patient populations. So we've done a good job of being able to do that for the safety of the individuals involved with that as well. We also encourage family members, to do FaceTime and things like that with their patients that are here in the hospital. And also our physicians have been very welcoming in the technology that's available out there through telehealth. They use it here in the hospital, and they also are using it a lot in their physicians' offices. And I think that's something that we'll continue to see too as we go through the future. I think that we have had some, the COVID epidemic or pandemic, whatever you want to call it, is very fluid. Every day we are learning something new about this virus as a hospital system or industry. And so we're making changes constantly. So we have plans in place for our patients. And then if there are surges that we need to reconsider, then we're constantly reevaluating our plans throughout the organization. And so I think it's a good thing that we're doing this, and the collaboration that it has brought from all of the different stakeholders in an organization has been phenomenal, from the administration through our line staff, our physicians, our governing board. Everybody's been very intimately involved in helping us to be a better organization and to secure quality and safety for our patients. I think in ending, what I would say to everyone today is that, again, there is a personal accountability that needs to be taken to heart throughout the world as it relates to COVID. And that is, again, making sure that you're doing what you personally can do to help reduce the spread of the virus. And what does that mean, right? I think we all know what those things are, but I would feel remiss if I didn't remind you about those things. And that is wearing a mask when you are in public places, when you're having conversations, even when you are in conversations and you're 6 feet apart. I think it's still wise to wear the mask for everybody's protection. Washing your hands, and then just doing the things that are appropriate as it relates to your safety when you're traveling and you're doing all the things that need to be done. So we all have a personal responsibility to carry these things out every day in everything that we do. Again, I thank you so much for allowing me to be here today. Chris, thank you HS for sponsoring this, and Noel and James, thank you for being our moderator. Thank you.
Thank you, Teresa. I really appreciate it. So we have a couple of questions for you all, and we're just going to dive right in. Let's, Chris, why don't you take the first stab at answering this one? But and then by all means, Teresa, Dr. Rastogi, feel free to weigh in. But how has technology and systems changed within healthcare to adapt to COVID while keeping hospital staff and the public needing other medical care safe? We talked about telemedicine and a couple other things. What's some of the other things you all are doing? Chris, you're muted.
Sorry. No, that's a very good question. Technology definitely has become an enabler in the support of the delivery of care during the pandemic. I think it's also identified tremendous gaps that we have in technologies that are needed for situations like this. A pandemic is really not kind of an unusual business interruption. I mean, it's something that's really completely different. It unfolds over months. It has different degrees of severity. It attacks different parts of different regions in certain different ways. And so, we need to have in place technologies that allow you to capture information that can allow the clinicians to make better business and clinical decisions. And so first and foremost, and I think everyone has mentioned this, virtual technologies have obviously been adopted, both in a clinical setting, but also in the business setting. Just the fact that we're having this type of event through a virtual vehicle is an example of that. Telemedicine is something that's now becoming now a mainstream tool for clinicians to provide care for patients and to follow up and monitor patient care. I think Dr. Rastogi mentioned, AI, artificial intelligence, is another area. It's still very much in its infancy in healthcare, but has wide possibilities for its application. Not only just on analyzing data, but improving clinical workflow. For example, using things like virtual assistance technologies that will allow the clinician to focus on delivering care to the patient while the technology is capturing information about that patient's current conditions. And so the clinician now doesn't have to focus their attention on entering data into a computer or into a device. That device can be listening to that conversation, capturing relevant information, and populating the electronic health record system itself. Interoperability, I think, is really an area that's still a gap, quite honestly, in the industry today. How do healthcare providers share information about the current status of patients within their communities with others who want to understand its impact, or if those individuals come into their communities, understand their current conditions and be able to respond appropriately to that. And so there's tremendous opportunities to continue to improve our ability to share patient information, to aggregate that information effectively, and then to put in place technology that make it easier for clinicians to do what they do best, which is to focus on the patient themselves. In addition to that, we talked about some of the things like 3D printing, improving logistics management. I mean, these are things that will improve operational efficiencies and reduce the cost of the delivery of care as well, too. So there's a wide variety of technologies that are being implemented today. And at DSS, one of the things we're asking ourselves is, what is life like post-COVID-19? what types of technologies and solutions will Dr. Rastogi and Teresa and others need within their clinical settings to continue to mitigate these risks going forward? Now that we've agreed and adopted these things like telemedicine and other technologies, what on top of that do we also need to make sure is in place to deal with the new norm that we'll be in post-COVID-19? And so, not to give a kind of a plug of what we're doing with Geno EHR, but we are thinking about that in the design of the workflow within our tool, how the infrastructure is designed so that we can share patient information more effectively, and how do we create solutions that are looking towards the future and not saddling the clinicians with the laborious activities related to the technologies of today.
Dr. Rastogi, you have anything to weigh in on that?
Yeah, sure. I'll just, just gonna piggyback on and add a little bit more color to a couple of things that Chris touched on. So one, I talked a bit about telehealth during my segment. If we think about, what some of the biggest issues for us on a global, from a healthcare standpoint, that even predated COVID, right? So one is access to healthcare. If you think about the U.S. today, and the most recent data I've seen is probably from about 12 to 18 months ago, it says that the average time that it takes to get an appointment with a primary care doc is about 19 and a half days across the U.S., right? So we think about, now, we all know that there's primary care physicians in the community that have open appointments. Using a technology like telehealth, we could actually level load some of that, right? Because we should be able to remove the barriers that are there across state borders to be able to do that. And then the second piece is also the cost standpoint. We know, again, that our healthcare system today is an issue for us from an affordability standpoint. And through telehealth, we can actually provide some of the care that we provide today at a lower cost point, because we don't have then the burden of the brick and mortars that are there. So, I do hope that a lot of the barriers that have been removed today because of COVID, both from a regulatory standpoint and from a payer standpoint, will persist even beyond COVID, because I think then the true leverage that telehealth can provide for us will continue on even beyond COVID. I know Chris touched upon EHR interoperability. It's funny when you think about, again, about 10 years ago when EHRs were really put into practice, the hope that we all had was it'd be easy for us and easy for patients to be able to access healthcare data, right? So if you take a look at a time like today, when we're in the middle of this pandemic, so let's say if a patient that normally is frequents Teresa's facility, if she's inundated, they come to Jupiter Medical Center or vice versa. Why shouldn't it be easy for us to be able to provide that healthcare data to both the providers and the facilities? And then the final piece is I'm going to talk just a second about artificial intelligence. And I agree. So actually, about a year or so ago, I did a certificate in artificial intelligence at MIT because I really wanted to get a better handle on artificial intelligence, only because I got tired of seeing commercials which said, now they have a coffee cup that has artificial intelligence, okay? So I think there's a lot to be said about separating the wheat from the chaff. And I agree that today it is not ready for prime time, but I do think it will be in the next few years as we think about computing power and software development. So let me just draw a quick scenario for you. If we think about COVID today, every day we hear about a new treatment that either is in favor, out of favor. We talk about hydroxychloroquine, we talk about remdesivir, where does it matter? What if we had a centralized, repository, which quite frankly gave the latest recommendation that physicians could use at the bedside for clinical decision support, right? So again, this does not in any way replace the providers, whether they're APRNs, whether they're physicians, but it really just provides a tool for them to help make better decisions. I do think that that's just a few short years away for us to be able to do.
Thank you very much. And Teresa, I have a new question for you and Dr. Rastogi.
Okay.
So let's dive into it. Let's get real timely. We hear that there's thousands of people getting sick every day. What are the trends at our local Palm Beach North hospitals? What are you seeing in terms of patients being admitted? How severe? What's the right now of the situation?
Well, I would say right now what we're seeing is pretty much what's with the trend with the state of Florida and Palm Beach County, at least here at Palm Beach Gardens. The patients that are presenting to our emergency room are a younger population. and are not as high acuity as before when we first started with COVID. It seemed to be an elderly population, and maybe they had other concomitant medical problems that really exacerbated and made it a lot difficult, more critical care type patients. And now we see less of the critical care type patient and more of a medical patient, as well as we see patients that present to the emergency room that are, again, a bit younger, but they're not sick to be admitted to the hospital. So we test and then we send them home, and then, we send the results back to them as well. But we are seeing an increased number of positive cases overall. Again, it's a lesser acuity type patient, and we have seen lower mortality rates as it relates to that as well.
Yeah, we're seeing a similar trend at Jupiter Medical Center as well. We've definitely seen a continued uptick, let's say over the past 3 to 4 weeks, with regards to the number of cases that we're seeing. One of the things that we were fortunate to be able to do once we had a bolster supply of testing was to be able to accommodate many of those patients who aren't sick enough necessarily to have to go to the emergency room, and accommodate them at our urgent care centers, where we were able to set up some drive-through testing facilities, especially because, as Teresa mentioned, we're seeing a similar pattern with regards to a younger segment of the population presenting with symptoms at this point. And fortunately, because the vast majority of them are not sick enough to be hospitalized, we're able to test them and then give them recommendations with regards to isolation, and then what would be for them to watch out for if symptoms got worse. What should they do? Give them those types of recommendations. So then what that's allowed us to do is, at the hospital side, really focus on the patients who needed to be hospitalized. We've got a dedicated unit where we have treating COVID patients. Also, the advent of the quick testing with regards to availability of multiple modalities has helped on the outpatient side, whether we use Quest, LabCorp, or others. The results can take anywhere from 24 to 72 hours. Now, most of us have the ability to be able to rapid test patients, which is also important because, let's say, if somebody who comes in with chest pain and we know they have to go to the cath lab to be evaluated by the cardiologist, we're able to do a rapid test to make sure that they don't have COVID as they come into the hospital. So again, those things have been incredibly important for us. We are seeing less patients on ventilators than we did earlier in the springtime. I'm hoping that that's a trend that's going to continue. One of the things that I'm concerned about, even though I know today the mortality levels have dropped, is that, as we know, this is a progressive disease in terms of, let's say if we test somebody within the first 24 to 48 hour symptoms, the great portion of those patients, especially the younger ones, will get better. But for the ones who get worse, a lot of them may require hospitalization. The ones who require hospitalization, then there's a segment of those that may go on to ICU and ventilated care. So I do think the ventilator and mortality trend in the upcoming weeks will increase. We hope that we're able to keep up with on the capacity side. Obviously, that's determined by the speed of the spread in the community.
Great, thank you all both for that. So Dr. Rastogi, what are if I'm a business owner and one of my employees or one of my patrons tests positive, what would be the recommended course of action? How would we address that?
Sure. So a couple things. Obviously, as soon as possible, you want to make sure that person is isolated, not just from the work standpoint, but they're given instructions they need to isolate themselves really from everyone they can, even from a home standpoint. Number two, they want to make sure that they're also following up with their primary care physician, because there's the one piece that I mentioned earlier, which is great. We've made the diagnosis that you have COVID today, but then we need to make sure that they have the access to be able to follow up with if their symptoms get worse. What are the things they need to look out for if somebody in their family develops symptoms? What should they do? So they need to be able to have access to to that type of advice. And then finally, even within the office space, then there has to be some level of contact tracing in terms of who did they come into contact with while they were in the office during not just the day that they were diagnosed, but during the preceding days as well. So I think those are all important components for us to think about in the workplace as somebody's diagnosed with COVID.
Teresa,
I just wanted to comment real quickly on that as well too. I think also businesses have to take a proactive approach as well too. For example, encouraging their employees to wear masks and PPE equipment. finding ways to conduct business in more virtual settings, continuing to provide education and support around the pandemic and its impact to the business itself. And then if an employee isn't affected by the COVID-19, providing both not only medical support, but emotional and psychological support for their employees as well too. I think it's important to let them know that, somehow this is not a scarlet letter that's placed upon them, that anybody could have been impacted by this, and that they are still valued employee, and we need to find ways to continue to make them valuable and contribute through while they're going through remediation of the care.
Teresa, do you have anything to add to that?
I would just add one other thing as it relates to the businesses is that, is outlining what the expectations are, as a company. And there's a responsibility for employees to, self-report, if you will, if they're feeling bad, they have a temperature, then they shouldn't come to work, right? They need to make sure that they're not infected with COVID and bringing it to the people that they work with, but to take precautions, call their physician, their provider to get the appropriate testing and that sort of thing, to be sure that they know what they have. Because there's more things out there than COVID, right?
Right.
So not everything is COVID. And I think sometimes people, think that of course, in the world that we are today, but many times it can be something else as well.
So speaking of just people in general, what is the best course of action that someone can do? Where's the best place for them to get tested? What precautions can they take if they think they are, but also don't want to catch it? What can we really do as people, employers, staff? What can we do to really stop the spread?
I think, look, obviously all the preventive things that we talked about earlier are important. And I'll just add one more thing on the proactivity standpoint. I know Chris mentioned about wearing masks and having dividers. Agree with all that, but I would even take it a step further back, and it's something that us and many other organizations are constantly evaluating: who really needs to be in the office, right? And how do we manage folks either rotating on different days, and just really thinking very, very creatively. I agreed completely that we have to balance both the public safety side and the productivity side, but again, being very proactive about that on a daily basis. With regards to whom they should seek, I think quite frankly at this point, I always tell folks, and maybe I'm biased because I'm a primary care physician, call your primary care physician first. But the reality of it is that the right answer is wherever you can really get the testing in a timely manner, and that ends up being a moving ball just because of, again, some of the shortage issues that we've all heard about with regards to availability of testing. But obviously we want to make sure, and that's something that I know most employers, and if they aren't, I would urge them to just have somebody in the HR department keep track of, where are the access points for testing. I know there are some either county or state or federal sponsored facilities that are occasionally set up, urgent care centers, hospitals, primary care offices. But again, it really is a moving target. Someone who has access today from a facility standpoint may not have enough supplies to provide the same access a couple of weeks from now. So I think that it'd be great for the HR divisions. I would recommend that for companies to kind of keep track of if they have an employee that reports with symptoms, where could they actually send them today if they need to get a test?
So I'm actually going to bring up a question from our chat from Patricia that kind of piggybacks on that. Do you feel are you able to obtain adequate PPE materials to do testing and carry on hospital operations right now, or is there a supply constraint?
I mean, I can respond to that. I think that we have done a good job about maintaining our inventory of PPE, personal protective equipment for our staff and everyone involved. There's opportunities that you have to look at what you do, and you go on conservation mode and try to be as efficient as you can based on the fluctuation with the COVID pandemic and what it's presenting to your individual facility. But that's something that we keep track of every day. There's an inventory of every type of PPE that we have in-house, and we know our supply chain, and we know when we get deliveries. Same thing with the testing that's been discussed. We have to make sure that we have the kits and the reagents, and we track that as well on a daily basis and have been very successful with that. And currently we are in good shape as it relates to the PPE and the processes that we have in place to do that.
Yeah, I'll just echo it from the similar comments. We're also fortunate that, we luckily have not had constraints on the PPE and the testing side. But with that being said, whenever anybody asks me, do you have enough PPE or do you have enough testing? I tell them for today, yes, I do. And I want to expand on a little bit because I think it's important. As I mentioned earlier, since January, we have had standing orders for all PPE, for all testing supplies across multiple vendors. So no matter how much we have, we're always ordering more. But with that being said, there's been times when we're down to, as I'm sure Teresa's facility does, we always calculate run rates. How quickly are we running through this? And there's been times when we're down to about a 7-day supply. Fortunately, that now we have a couple of months for just about everything that we need. But with that being said, and again, if you look, I believe there was an article in the Atlantic over the weekend which talked about, because of the case rates that have increased so significantly across the country over the past 2 to 3 weeks, we're anticipating a shortage of testing supplies. Because you remember that there's the testing supply piece, and then there's the testing turnaround time piece, and we know that Quest turnaround times, by their own admission, have increased from 1 to 2 days to about 4 to 5 days just over the past week. Because even if you have the ability to have a test, they're not able to run enough tests through their facilities to be able to process all of the tests that are needed.
I wanted to just add a little twist to that as well. I mean, we focus quite a bit, which rightly so, on ensuring that our healthcare providers have access to PPEs. But also, we need to be thinking about that for our commercial businesses as well, too. I mean, my business, for example, needs to ensure it has adequate access to sanitizers, disinfectants, masks, and other PPE, gloves, and other PPE equipment as well. And so I think, we, to a certain degree, have been able to ensure that providers have adequate access. But I think there are challenges when you get outside of the healthcare community to the commercial market, finding access and getting access to these products as well, too. And so I think as a whole, we need to think about, how do we address those issues? Because as you talk about prevention and the things we can do, if we don't have masks, we don't have gloves, we don't have sanitizers, how can we adequately spread?
That's a great point, Chris. So I'm gonna go ahead and do another question here. I'm gonna take another question from our chat. This is Anthony, and I'm gonna kind of blend it with one of the questions we had lined up already, which is, clearly there's an opportunity here to leverage more digital health and provide hospital-grade solutions in other locations like the home or places that aren't necessarily a hospital. So what are the roadblocks to that? And then also kind of like, what is the future? What are the permanent changes that may happen because of COVID in the healthcare industry?
I want to jump on that real quick. I think we have to take a more holistic approach around how we leverage technology, both in the outpatient, acute care, and settings. I think it first and foremost starts with stronger partnerships between technology companies like the DSSs of the world and the provider community. We need to be sitting down, having these kind of critical conversations about what are the challenges that exist within your environments, and how do you think technology can help to solve that problem or enable a better outcome? And then we need to partner with you to develop those solutions. I think a lot of times what happens, and I'm sure both Dr. Rastogi and Teresa experienced this, they'll get calls from vendors and say, hey, I've got this great technology that I think you need. And you'll say, no, I don't really need that. Or it's not a high priority for my organization. That's not our issue of the day. Our issue are these other 3 or 4 things that we're challenged with. Well, we need to sit down and have better conversations and more collaboration between all the constituents involved in the delivery of care. And technology companies have just as much of a responsibility of providing solutions that help deliver better care as the providers in the delivery process. So I think first and foremost, it starts there. We also have to, again, think outside of the box. We think about things like patient-centered medical home, or age tech. Every day 10,000 people are turning 65, and that'll happen for the next 25 years. Are we thinking about what types of technologies can our senior citizens start to adopt and leverage to manage their care better, to make them more independent, to be more proactive in the delivery of services to them as well as looking at the other demographics, the Gen X, the Gen Ys, the baby, the Gen Zs and others, and what technologies are they adopting that we can leverage so that they start being more proactive in taking care of themselves as well too. So I think it's a holistic approach around that. And I think if we do develop partnerships and we look at our healthcare organizations as technology incubators, accelerators, then we can start producing the types of solutions that ultimately will make a huge impact on the delivery of care.
Jim, I'll just add one comment that I know, and we spoke earlier about roadblocks such as, payer or regulatory ones. I think, one of the roadblocks which I've seen removed, which I have to commend the FDA for doing, is a lot of the emergency use authorization that they've, granted. If we think about some of the rapid testing that we have for COVID today, we wouldn't have access to that technology sometimes for a year or two after it was developed. But I do think that the FDA, has done a good job of giving providers earlier access and removing some of the roadblocks from that standpoint, technology. And I do hope that that continues into the future as well.
Right. So one of you mentioned conservation mode when talking about PPE, and this is coming from Ophelia in our comments. What exactly does conservation mode mean?
That was me that said that. And
Yeah.
What I mean by that is that what we do is we have our COVID track, as I mentioned to you, the COVID patients. And so what we do is we have less caregivers or less individuals going into that room and having the nurse or the other individuals do more of the work that, to prevent the use of turning over the PPE and stuff like that. So it's just looking at operationalizing how we do what we do to be more efficient.
Great. So one real quick question for Dr. Rastogi. And Teresa, why the lower mortality rates despite higher number of new cases? Why are we learning to treat it better? Are we learning to take care of patients better? What's going on with that?
So I think it's a bit of all of the above that you mentioned, Jim. I mean, at this time we are seeing a younger population, for which overall the mortality and the morbidity, fortunately is lower than it is in the older population. But over the past couple of months, we have started to understand better, even if patients end up in the intensive care unit, when should we put them in a ventilator? We know that now for COVID patients, for the most part, it's a little bit later than we would have for other diseases. Access to convalescent plasma therapy, access to remdesivir, all those things have helped us, a bit. But I think if the mortalities numbers stay there, we'll have to. I think that still remains to be seen over the next 4 to 6 weeks.
All right. Teresa, do you have anything to add to that, or?
No, I would echo exactly what Dr. Rastogi said.
Right.
I think that, honestly, I think I mentioned earlier that physicians and everybody's learning more and more about the treatment of the COVID patient. And so I think that they have instituted great treatment measures that have helped in reducing the amount of complications and severity of some of the COVID patients. So I think it's just it's an ongoing process of learning that we're seeing and making changes in all aspects of what we do for those patients.
All right. So we have 2 minutes left, and I'd like to get 2 quick questions in, okay? One is for Chris. All right, this is from the chat. This is from Patricia again. How do you feel contact tracing and artificial intelligence will affect privacy issues?
It's a really good question. I think if most of us go on our cell phones today and we go into our settings, there's already a contact tracing app that's been pushed down to your cell phones. You don't, not enabled for most of us, but it's there. And I think when we talk about the new norm, the world that we live in, there's a little bit of our privacy that we're going to have to think about giving up in order to make sure that, pandemics of this type can be managed more effectively. And at least from my perspective, and this is completely Christopher's perspective, not DSS or anyone else's, is that I'm willing to give up some of that in order to, be able to better manage pandemics going forward. And I think, we have to, but, you can do that in a way that still protects the anonymity of the individual, but still allow healthcare professionals to do things like population disease management, surveillance monitoring, so that when they start to see spikes occur, they can be more proactive and react to those in a better manner versus, having to be overwhelmed by the vast number of people coming in that are impacted by this and not being able to try to find who patient zero was that caused the problem in the first place.
Right. All right. And so for the last question, this one's really geared towards Teresa and Dr. Rastogi. So this is the question I think on everybody's mind perpetually, and I know there's no crystal ball and there's no way to predict anything. But how long are you all preparing for this to go on and impact how we do things?
Yeah, I mean, I'll certainly say from my standpoint, again, and the data point that I'm using is kind of past pandemics, but also factoring in that today the technology and access that we have to drug development is faster. So if you think about it in the past, the fastest vaccine that's ever been developed has really been 4 years, right? So again, that was about 40 years ago. So if we're better today, there's a concerted effort around the world. Maybe we get there in the next couple of years. So I do think that the pandemic, will still have an impact on us in a material way for the next 18 to 24 months. And that'll reverberate not just throughout the healthcare system, but I think throughout the global economy.
I concur with that. I would agree with what you said. I think you asked me when thinking about that, I was initially going to say like 18 months, but it's probably 18 to 24 months. And a lot will depend on if we're able to get a vaccine and stuff like that in place to hopefully help. So those are some of the things that we have to look for.
Right. Well, with that said, Teresa, the optimism is hopefully a vaccine will get here in a reasonable time, safely, with good efficacy that can help everybody, as well as get us back to perhaps a new normal with some things we've discussed today. And I just wanted to thank you all three of you, for a very realistic look at the now, as far as the business of healthcare, technology, how we're dealing with it locally here. I just really wanted to say thank you all for your time again. Thank you to our friends at the Chamber for the avenue to speak to everybody, not only on Zoom, but also on Facebook Live. And with that said, Noel told me he doesn't have any other comments to add, but I just want to recommend everybody stay tuned to the Chamber's Facebook page, as well as the Chamber newsletter for updates. And also just wanted to say once again, thank you to DSS Incorporated and Christopher for sponsoring this. It's important dialogue like this that allows us all to really contribute to the betterment of our community. So thank you all very, very much. And for everybody that was tuning in on Zoom and Facebook. So everybody have a great rest of your week.
Thank you.
You too. And wear your mask. Wear your
Yes,
mask.
wear your mask.
Wear your mask.
Thank you.
All right.
Wonderful.